Starting off with the biggest collective action doctors in the country are showing in years. After the Yoon administration announced its plan to expand the medical school admission quota from next year, doctors' groups have been submitting letters of resignation in protest. Trainee doctors at major hospitals have opted to stop working from this morning, raising concerns of a healthcare catastrophe. Our correspondent Ahn Sung-jin is at one of the top 5 hospitals where doctors have been walking out of. Sung-jin, tell us a little bit more about the scene you're at and how the country's doctors are taking collective action.
Good afternoon, Ye-eun. I'm standing in front of Severance Hospital in Sinchon, Seoul, where trainee doctors have just started walking out from 6 a.m. this morning. Now, this hospital is one of South Korea's so-called Big 5 hospitals, where more than 20% of the total number of trainee doctors work. These Big 5 hospitals have nearly 3,000 residents, and 1/3 of those residents have submitted their resignations. This hospital in particular saw the most cases of doctors leaving the workplace. These walkouts are in protest of a government policy which aims to increase the quota of medical school admissions by 2,000 places starting next year. Doctors' groups argue that increasing the number of doctors would lead to unnecessary medical care on top of a lack of incentives for doctors to practice in essential areas such as pediatrics and emergency medicine. But health authorities said more doctors are vital to keep up with the country's fast-aging population. The number of doctors in the country relative to the size of the population is reportedly among the lowest in the developed world. As these trainees doctors play a key role in medical processes, at least 25 operations have been canceled and 34 official complaints have been made by patients. As of 11 p.m. yesterday, more than half of other trainee doctors from other major hospitals nationwide, nearly 7,000 residents in all, have submitted their resignation letters as well. As walkouts begin today after the mass resignation of trainee doctors, the health ministry and medical community says that the temporary system they've put in place could hold up for only 2 or 3 weeks without these key medical personnel. The Korean Medical Residents Association will be discussing further responses at the emergency meeting, which just began at noon.
Right, and the health ministry and officials have been convening to find ways to better respond to this crisis. With concerns over a lack of necessary medical personnel at those hospitals, though, how is the government currently looking to respond to this?
About 400 emergency medical institutions nationwide will be monitored 24 hours a day from the National Medical Center. If the gap due to a lack of necessary doctors remains for a longer period, the government also announced that it will allow non-face-to-face treatment.
There are 12 military hospitals where emergency rooms are operating. We have also decided to open them to civilians.
Now, the government has maintained its position, refusing to accept doctors' demands and denouncing their collective action as intolerable. It is said that President Yoon said that the medical community cannot defeat the people. The Yoon administration had sent a prior notice to key figures such as the chairman of the Emergency Response Committee of the Korean Medical Association regarding the suspension of their doctor's license. The health ministry also just issued a work start order to 757 medical residents. Whether this will be taken as a warning to the medical community will be something to look out for. That's all I have for now. Back to you, Ye-eun.
All right, thank you, Sung-jin. That was Ahn Sung-jin from Severance Hospital here in Seoul.